Rheumatic fever is a systemic autoimmune inflammatory disease that can involve the heart, joints, skin, and brain. It occurs after 2 to 4 weeks of untreated throat infection of bacterium Streptococcus pyogenes. If the rheumatic fever involves the heart muscles, then it's called rheumatic heart disease, in which mainly mitral valve and sometimes aortic valves develops fibrous scar tissue due to repeated inflammation of the valves and becomes thicker, which leads to the complications of the heart like regurgitation, atrial fibrillation, and heart failure. Signs and symptoms include the fever, multiple painful joints, involuntary muscle movements, non-itchy rashes on the skin. In 50% of the cases, heart muscles are also damaged, which leads to the heart failure. Mechanism is believed to involve the production of autoantibodies against our own body tissues. When the bacteria enters into the body, our immune system starts producing autoantibodies. Because due to the similarities between bacteria and body tissues, antibodies starts damaging our own body organs. To make the criteria for diagnosis of the rheumatic fever, symptoms are divided into 2 categories. The major symptoms involve the inflammation of the joints, inflammation of the pericardium, subcutaneous nodules, skin rashes, and involuntary muscle movements. And the minor symptoms involve the pain in the joints, fever, prolonged PR interval in the ECG, and increased erythrocyte sedimentation rate. The diagnosis is confirmed when 2 major symptoms are present, or 1 major and 2 minor symptoms are present, along with the streptococcal bacterial infection. Treatment of the rheumatic fever involves the use of anti-inflammatory drugs such as aspirin or corticosteroids to reduce the symptoms of the rheumatic fever. Use of antibiotics such as penicillin G-benzathine or penicillin VK. Patients with symptoms of the heart failure are treated with the diuretics, beta blockers, and digoxins. Bed rest is an important part of therapy in patients with the cardiac involvement. Like and subscribe to our channel. Thanks for watching.